Luis, you're muted.
Yeah,
Okay.
I want to welcome you to our new distinguished colloquium on climate change and biological sciences. This is the inaugural talk, so we're very excited about it. This is a new talk series that came out of the initiative of a number of faculty in Biological Sciences Division and in coordination with the Dean's Office to really identify and explore important issues, needs, and research opportunities at sort of this time of change, particularly climate change, and at many different scales, from local issues to global issues. Part of the objective of the series is really to bring the most distinguished scientists and compelling speakers as well to speak to share their knowledge and their vision with our community. And so the series runs in the spring. There'll be 3 talks, and the initial themes are on public health issues and biodiversity. So, so this is co-organized by the Biological Sciences Division at the University of Chicago and the Mansueto Institute for Urban Innovation. So as we were conceiving this, we obviously thought of Jonathan Patz, and we hoped that he could be our inaugural speaker. So thank you, Jonathan, for doing this. With that said, I'll pass it on to Diane Launderdale, who's the Lewis Block Professor of Public Health Sciences and Department Chair, to introduce Jonathan. Please share your comments or questions in the box, and Dodge at the end will select from these for a little bit of question time at the end. Thank you very much. Diane, please take it away.
Thank you. Adding to Luis' comments, when we faculty got together to brainstorm names for this colloquium series, Jonathan Patz was on almost every list, I think. And so we're very, very pleased that he is able to start off this series. He's the director of the Global Health Institute at the University of Wisconsin at Madison, and the Vilas Distinguished Professor and John P. Holton Chair of Health and the Environment, with appointments in the Nelson Institute for Environmental Studies and the Department of Population Health Sciences. For 15 years, Dr. Patz served as a lead author for the United Nations Intergovernmental Panel on Climate Change, the organization that shared the 2007 Nobel Peace Prize with Al Gore. He also co-chaired the Health Expert Panel of the U.S. National Assessment on Climate Change, a report mandated by the U.S. Congress. He's an elected member of the National Academy of Medicine, and he is a very widely published author of scientific papers, thought pieces, and textbooks on health effects of global environmental change. Thank you so much, Jonathan, for joining us today. And let me also say that we are going to hold questions to the end, but as you think of them, please type them into the chat, and Anne is going to moderate a discussion at the end and bring you back to present your questions. Thank you.
Well, Diane, thank you so much for that kind introduction, and for you and Luis and others at the University of Chicago for giving me the honor to be your inaugural speaker for this exciting series. It's really, we're going to have a series like this up in Wisconsin too. But this is, it's just great to be here. So I'm going to share my screen, and you can signal that it looks okay once I've got it up. Does that look good? Okay, great. Well, I am going to be talking a little bit about climate change as a health crisis, but that actions on the climate crisis offer major and immediate health gains. So I'm going to give you some negative information, but then show you there's really reason for hope as we tackle this challenge. Now, I'm going to show some data from Jim Hansen's group to convince you that it's not your imagination. Summers are really getting hotter. This is actual measured ground temperature in the summertime in the Northern Hemisphere. So here we go, 1951 to 1980, 83 to 93, 94 to 2004, 2005 to 2015. And of course, notice that the increase in the extremely hot days, the very red color here, that's very dangerous. So it's not, it's definitely happening. And the latest United Nations Intergovernmental Panel on Climate Change released its 6th assessment report last summer. And on the left, you see reconstructed weather temperatures back 2,000 years, actually back to 100,000 years, but we have a better sense for climate from 2,000 years ago. And if we just take a look at the last 150 years, this is the graph on the right, what's very concerning is that the rate of warming is faster than has ever been seen in the last 2,000 years. So very concerning. And these are quotes from the report that just came out last summer, the IPCC report, saying that recent changes in the climate are widespread, rapid, intensifying, unprecedented in thousands of years. It is indisputable that human activities are causing climate change. In other words, we are causing the problem. It's not just climate variability, making extreme climate events more frequent and severe. And unless there's immediate, rapid, and large-scale reductions in greenhouse gas emissions, we will not be able to limit the amount of warming above pre-industrial levels to limit that warming 1.5 degrees centigrade. So when this report came out last summer, it was pretty shocking, and the Secretary General of the United Nations called this code red for humanity. I had colleagues that said that red is not hot enough a color for how serious this situation is. And we had some very stark reminders in Western North America just this past summer with this incredible heat dome, the heat wave that extends in time and space. We saw record-breaking temperatures throughout the Northwest. We saw deaths from these temperatures. And we also saw a combination of the heat waves and the drought that led to incredible forest fires. And the smoke from those fires were seen all the way across the United States. Some interesting studies came out looking at wildfire smoke. It was not good news to find out that wildfire smoke, the particles, the PM2.5 fine particles from wildfire smoke may actually be much more harmful, 10 times more harmful on children's respiratory health than other sources of fine particulates. The other interesting thing, it's a new development that we have, is the attribution of these extreme climate disasters being attributed to climate change. It used to be that climate scientists could just say, yeah, we know that warming the planet is increasing the probability of seeing extreme events. It's loading the dice. But now with the statistical power and this World Weather Attribution Initiative across many universities in the UK and other countries, we're able to look at the statistics and be able to say with much better accuracy that, yes, not only was it more likely that that event happened, but the attribution to climate change is that much stronger. And this is looking at that heat dome that hit the Northwest. Statistically, today's 1 degree centigrade average warming around the world increased the likelihood of that event by 150-fold. And that seeing that type of heat wave and drought, it was virtually impossible without human-caused climate change. So we're able to get a better handle on really showing that climate change is at the root of these disasters. So we know, you all know, that climate change involves these physical attributes: rising temperatures, sea level rise from thermal expansion of salt water, extremes of the water cycle, so more droughts, floods, and fires. And the reason I've dedicated my career to this issue is because those changes will cut across so many different exposure pathways that harm us. climate change affects, us directly, as you saw from that heat dome, and the urban heat island effect, especially in cities with sprawling roadways and black asphalt and concrete buildings that retain heat. Heat waves are dangerous. Air pollution, not only from wildfire smoke, but I'll show a slide about allergens and infectious diseases, especially those carried by cold-blooded insects that are temperature sensitive. Waterborne disease, if we're thinking about extremes of the water cycle. And of course, our health depends on adequate water and food supplies. So droughts that may challenge food resources is a problem. Finally, mental health and forced environmental refugees, very significant issue. I think that issue may actually be the iceberg under the tip of the iceberg. So I'll show just a couple examples of these climate sensitive diseases, and then quickly launch into why I think fighting climate change could be a huge opportunity for health. Let's take a look at extremes of the hydrologic cycle. We're seeing in the upper Midwest region, the hash bars indicate statistical significance for heavier rainfall. We've seen 7 inches more rainfall annually compared to the average from 1950 to 2006. I encircle my state, which is a suburb of Chicago, the state of Wisconsin. We're seeing major problems with flooding, and you can see in the left side here all sorts of health concerns related to flood events. My team did an assessment of your city's drinking water, and we found that because of projections of extremes in rainfall intensity, that by mid-century, Chicago could see a doubling in the number of combined sewage overflow events, because many communities still, they can't afford to separate stormwater runoff from sewage. And so there are many places where it rains too hard and you have sewage contaminated stormwater that overflows into our lakes and streams. And that happens in the United States already. More than 1 trillion gallons overflow into lakes and streams every year. It's going to get worse with climate change. And so Chicago may see a doubling in the number of these events. Just north of Chicago is the city of Milwaukee. This is work by Dr. Sandra McClellan, who goes out and samples the water in the Milwaukee Bay area right after a storm. And so look at the sampling right off of South Shore Beach. It's flaming blue hot in high counts of E. coli contamination. Bradford Beach, pretty hot, high levels of E. coli. So heavy rainfall that is driven by climate change, we'll see increased risks from recreational exposures as well as drinking water exposures. But after flooding, in the emergency room, it's not diarrheal disease and water contamination issues. It's asthmatics actually show up in ERs following flood events. And that's because after flooding, you see flooded basements. People are cleaning up from flooded basements. And this is a major health problem. It's also a health equity challenge because unfortunately, it's poor communities, it's redlined areas from the past that are at more risk from these types of dangerous situations. So very concerning issue for our region, which is seeing much more flooding, heavy rainfall from climate change already. The other airborne and asthma problem that we're seeing is an increased risk for asthma due to pollen and aeroallergens like ragweed pollen. And we're seeing in our state, the ragweed pollen season is increased by 13 days. We've got more CO2 in our northern hemisphere, and Wisconsin has warmed by 1 degree Fahrenheit since the 1950s. So there are many parts, especially in the northern latitudes, that will be seeing a longer ragweed pollen season, and that's a problem for asthmatics. Now, some people argue that the largest threat from climate change regarding health risk will come from the smallest organisms. That's because if you are a disease that is dependent on cold-blooded insects, like this mosquito, well, the body temperature of that mosquito will dictate the replication rate and development rate and biting rates, and basically really are important with transmission dynamics. So whatever the air temperature is, that's that mosquito's body temperature. This mosquito species, Aedes aegypti, carries yellow fever, dengue fever, and Zika virus. And it's very well known that dengue fever, which is the most prevalent vector-borne, mosquito-borne viral disease in the world, is sensitive to temperature, and it's very seasonal. That mosquito resides in these regions of the world. It's where it shows up. And dengue fever is very common in Southeast Asia. And there have been studies showing the seasonality of dengue fever, especially in the country of Thailand. And just to break this down, you know, this is going up and down every year, up and down. It's very seasonal. But why in Thailand were there a couple of years that were really, you know, just really bad dengue fever years, very high number of cases? That's these red years. Well, it turns out that those 2 years had some of the strongest El Nino events in recent time. And in fact, 1997 was the strongest El Nino that has been recorded in the recent past. Well, it turns out that right before Zika emerged, the El Nino of the winter of 2015 into 2016 was tied with 1997 as the strongest El Nino in recent history, and actually lasting longer. And my colleague up here in Wisconsin, Dan Weimont, I asked him to check on the temperatures right before Zika and dengue erupted that winter. And it turned out that across Brazil and Colombia, the temperatures driven by that El Nino event were higher than 2 standard deviations above a 60-year constructed average temperature. So it was no surprise that it was a banner year for dengue fever. And Zika, which is transmitted by the exact same mosquito, and it's the same virus family, it's not surprising that Zika emerged at that time. This is a study that shows how those temperatures may have increased the transmission of mosquito-borne dengue and Zika, because it turned out that that period, that winter of that strong El Nino, made it was the highest vectorial capacity. In other words, because of the temperatures and the effect on the mosquito, the highest probability that one case of disease, a person who has disease, would lead to more cases because of the dynamics of how temperature affects mosquito-borne diseases. So it was the highest that it was in the past 60 years. And I had been telling everyone, because Zika is in the same family, virus family as dengue, and the same mosquito vector, Aedes aegypti, that Zika and dengue would be transmitted exactly the same. But laboratory studies actually show that Zika has a higher temperature optimum, 5 degrees higher than dengue fever. So one question that we have is, did Zika erupt because of that extremely strong El Nino and those unprecedented hot temperatures? We saw many years ago when West Nile virus came into New York City. It's a different mosquito, it's a different virus family, but it came into New York from international travel. But that July of 1999 was the hottest July ever recorded in New York City. So we wonder here with Zika virus that came into Brazil, probably from international travel, either the World Cup or canoe races, because there were some outbreaks of Zika in the Pacific Islands. It got to South America from international travel. But did these unprecedented temperatures have something to do with having Zika just take off? We don't know, but it's certainly a hypothesis that's worth taking a look at. So speaking of infectious diseases, we are having a pandemic, and the COVID-19 pandemic is caused by the SARS-CoV-2 virus. And there's some evidence, certainly with other bat-borne viruses, that deforestation has a lot to do with the disease emergence. Bat-borne Hendra virus emerged in Australia, and that's a virus that kills horses and can occasionally kill horse owners. That was tracked back to deforestation in Indonesia and Borneo, and there was radio telemetry on these bats, and it was determined that because of deforestation, they lost their winter food source and were forced to migrate, and they came down to Australia, and so the number of bats increased, these fruit bats. So just like Hendra virus, coronaviruses are mostly bat-borne viruses. They reside, bats are the natural reservoir for coronavirus. And there is a study that came out that asks the question of the influence of climate change in the Southeast Asian region, and that climate change could be disrupting the bat migration and changing the species richness of bats and the viruses that they carry, and may have been a contributing factor to the emergence of both the first SARS virus, SARS-CoV-1, and our current SARS-CoV-2 that's causing the present pandemic. We don't know this for sure, but it's certainly something that is worth looking at as far as the origins of this bat-borne coronavirus. So I want to shift back to, talking about climate change and the causes of climate change, and go back to the Paris Agreement, the United Nations Framework Convention on Climate Change, the Conference of the Parties that occurred in Paris, where that was the highest number of heads of state gathered in any one time ever in history. 147 heads of state came to Paris, and you had the Paris Agreement on climate come out of that. Well, throughout these assessment reports of the IPCC, 2 degrees centigrade average warming has been a set point where impact scientists have been saying, if you go above 2 degrees average warming, it's going to be disastrous. All coral reefs will die. Ecosystems will fall apart. Food crops will just dwindle. Crops will be dying, and it'll just be disastrous if we go above 2 degrees. So there's this effort to try to stay below 2 degrees centigrade warming, above pre-industrial levels. And so after Paris, the world leaders asked the scientists of the Intergovernmental Panel on Climate Change, what would it take to reduce emissions to avoid 2 degrees centigrade, but if possible, a little bit of room for comfort, can we stay below 1.5 degrees warming? So this report was written, this 1.5 degrees centigrade report from the IPCC, released just a few years ago, 2018. And the answer was kind of shocking. that to stabilize at 1.5 degrees centigrade warming, we would have to cut emissions by 45% by the year 2030. So 8 years from now, we would need to reduce emissions mostly from burning fossil fuels, but also, stop cutting rainforests that suck up CO2. We have to really cut back very quickly and get to net carbon zero by 2050. So alarm bells went off. The youth movement, Greta Thunberg and others are stepping forward and saying, hey, this is our future. This is an emergency. And we no longer call this climate change. We call it the climate crisis because it's an emergency. It's a crisis. We have to act, and we have to act soon. So my view on this dire news is that if through the public health lens, think about what it means to get to a low carbon economy and what it could mean for our health. This is an amazing opportunity. So I talk about climate change, challenges and opportunities, solving the global climate crisis, the greatest health opportunity of our times, and a low carbon future could improve global health and achieve economic benefits. So why am I optimistic? Well, if you take a look at these three big sectors to the right of the dotted yellow line, how we generate electricity, how we grow food, and what we're doing with cutting forests to grow rangelands, for example, and also how we move around our transportation systems. Those three sectors, we know of major health issues across these three sectors, and here's what they are. Energy sector, air pollution, burning fossil fuels. Everyone on this Zoom knows that air pollution is unhealthy. And the latest studies, this is a study out of Harvard that estimates that air pollution is causing almost 9 million premature deaths every year. The food sector, our energy intensive diets, especially from eating red meat, is very harmful for the environment, but also harmful to our health. And according to a very important Lancet Commission report that came out 3 years ago, if we could get to a universal healthy reference diet, similar to the Mediterranean diet, which is not very much meat and lots of fruits and vegetables, we're talking about saving 11 million lives, avoiding 11 million premature deaths every year. And finally, with the transportation sector, because of our overdependence of the private motorized vehicle, we are leading sedentary lifestyles. And according to several reports and the World Health Organization, because of that increase in sedentary lifestyles, that's almost 4 million premature deaths every year. If you add up those numbers across these three sectors, we're talking about nearly half of all premature deaths every year. So an incredible opportunity if we can get to a low carbon economy, especially to avoid these deaths that are caused by chronic diseases. So if I was to go back to COVID for a second, COVID-19, and look at the risk of dying from COVID, this study is showing that air pollution, if you live in an area and are exposed to lots of air pollution, your risk of dying from COVID increases significantly. I mean, look at East Asia and even in North America, that air pollution from fossil fuel related emissions increases the risk of dying from COVID-19, upwards of 14 or 15%. That's not trivial. And of course, during the COVID pandemic, in the beginning of this pandemic, the global economy was shuttered, and we saw days like on the right here in New Delhi, India, that they hadn't seen days like that for so long. And it just is a wake-up call. What could be any clearer comparing, the air pollution from when we shut down the global economy and stopped burning fossil fuels on the right side compared to business as usual. So it's not rocket science. We know how harmful air pollution is, but COVID and this contrast sort of showed us starkly, these stark images, just how bad it is. And even in the United States, where we have the Clean Air Act, this is, we have 75,000 deaths in the United States because of burning coal for electric power. And this is, where we see the highest risk. If we were to try to avoid emitting 1 ton of CO2, so a climate policy, burn less coal, reduce, stop burning, so that you would avoid emitting 1 ton of CO2, what would it cost? Well, the estimates were that clean technology, it might be $30 more, up to $30 more to get to avoid emitting a ton of CO2. But when you don't release that CO2 from burning coal in particular, what else do you avoid emitting? You don't avoid all the nasty air pollutants like fine particulates, PM 2.5, sulfur dioxide, lead, mercury, right? So for every ton of CO2 avoided, just focusing on the fine particles, PM 2.5, the health benefit from that reduction in fine particles, from reduced mortality and hospitalization, would on average be $200 in health benefit for every ton of CO2. And so when I ask policymakers, I say, which number is bigger? The cost of clean energy of $30 versus the health benefit from cleaner air of $200. And, in other parts of the world that are more polluted, those numbers would even be higher for the health benefits. And I've taken this to the state legislature in Wisconsin, and I was happy that they admitted that they've only been focused on this number. They don't want to pay more for energy. And they didn't realize how beneficial it would be for health. But even now, we have to question this number, because even energy experts have been shocked by the rapid drop in price of solar energy, beyond what anyone predicted. And for the first time ever, we see, this is a report from the International Renewable Energy Agency, showing that for the first time ever, the cheapest way to generate electricity, if you remove all subsidies, so it's an even playing field, the cheapest way is from renewables and batteries. We didn't have that before. And I spoke at an energy policy meeting a few months ago, and next to me was, in fact, I have his card right here, someone from the conservative energy, well, I had his card right there. Anyway, he's a conservative for energy policy, and he introduced himself as a conservative Republican, and because he's so concerned about a free market and very cost sensitive, he is absolutely 100% board, 100% on board for renewable energy. So we don't need to wait for a miracle for changing our energy system. There's no reason for delay to get to clean energy. I'm going to talk less about the other two sectors, but just jump in here with this major Lancet Commission report, ironically called the EATLancet Commission. Don't ask me what that acronym is, but it's the EATLancet Commission report on sustainable, healthy diets and sustainable food systems. And I'll just focus on one figure from the report. And this is highlighting their healthy, their universal healthy reference diet, which is a diet that we all know, more fruits, vegetables, whole grains, unsaturated oils, some seafood. no or low quantities of meat, processed meat, or these starchy vegetables. And basically, if you look at the figure, everything to the right of this dotted line, the shaded areas, we should get away from. You know, we have to really reduce our meat consumption, starchy vegetables, and these other things. So if we were to get to this universal healthy reference diet, what we would see is a savings of 11 million lives, avoided 11 million deaths every year. And because of what it takes to raise red meat versus other sources of protein, we would see enormous benefits to the environment as far as less energy needs, less water needs, less food, less land needs as far as raising cattle and things like that. So incredible opportunity here. We also need to be thinking outside of the box. And I've been working, my past postdoc, Dr. Valerie Stahl, has been working on alternative protein sources. Insects are one of them. Obviously lower impact on the environment, easy to raise and scale up. There are many insects that are edible, and there are billions of people that by choice eat insects. Other environmental benefits, and very nutrient rich. And I'll show you a study that we just released with Harvard University. It's not everything, but we need to be thinking about alternative, more sustainable food systems. So this study led by Harvard that we participated in looked at how would insect protein, so insect powder and protein from insect powder, what would it mean for micro nutrients around the world? And I just want to cut to the chase for the sake of time and show you that 5 grams of cricket powder daily, especially in South and Southeast Asia region, would lead to enormous nutritional benefits. So 67 million fewer people with protein deficiency, 160 fewer people with zinc deficiency, and over 200 million less people at risk of folate deficiency. So, we need to be thinking this way. Great potential benefit and low cost to the environment. And finally, the transportation sector. There are nearly half of American adults do not meet recommended level of exercise, the minimum recommended level of exercise by CDC. One study looking at walking and cycling for commuting showed marked changes in the prevalence of obesity and diabetes. So 20% lower obesity rates, 23% lower diabetes rates in those cities with the highest levels of walking and bicycle commuting. And we all know that exercise is healthy. It's more than just burning calories. It's huge benefits to reducing heart disease, cancer, dementia, depression. So it's a no-brainer that exercise is great, but we have designed exercise out of many of our cities. And the bad news, if you look at the average rate of bicycle commuting in the United States, it's actually 0.9%. So we rounded off to 1% is the average bicycle commuting in the United States. If we were to get to my level, I live in Madison, Wisconsin, we have a 6% bicycle commuting rate. If the country got to 6%, that would save about 20,000 lives. If we got to a level of Davis, California, 20%, we're talking about 45,000 lives. And if we were to get to Amsterdam levels of bicycle commuting of 40%, that's over 60,000 lives in America that would be saved every year. Now, this shows the potential major physical fitness benefit from active travel. But we need to design cities safely. You know, we cannot just say, go out and ride a bike and the urban design is not there. We need to absolutely demand cities designed and redesigned for people, not just for motorized vehicles. So this is a clear message we need to carry and carry that forward. And finally, I'll wrap up by showing just how beneficial these nationally determined commitments to reduce greenhouse gas emissions can be for our health. If you take the Paris Agreement targets, for example, the EU was coming in at 40% reduced greenhouse gas emissions. The United States was coming in at 28% reduced emissions, and so on. If you take the 9 countries that actually represent about half of all greenhouse gas emissions globally, these 9 countries on the map, and if they met their Paris agreements across these 3 sectors I've been talking about, you know, energy, food, and transportation, we could see upwards of 10 million lives saved every year if we met the Paris agreements. So my clear message, I hope it's a clear message, is that, you know, yes, the climate crisis, it's here, it's now, it's real, and it's serious. But that the interventions, you know, taking actions on climate change can have this huge number of health benefits. And so I conclude by saying that during a global pandemic stemming in part from environmental damages, we have the opportunity of a lifetime to seize the moment for transformative change that ultimately improves our health. So with that, I thank you very much. There's my Twitter handle, and you can Google me, my TEDx there. So that I will stop sharing my screen, and I am open for questions.
Thank you, Jonathan. That was wonderful. So I asked Ann Dodge to kind of compile some of the questions that are coming in the chat. So I'll let her do that. But it's really a puzzle, not a puzzle, but a great question. How do we align these benefits and put them in the radar? People who are thinking more in terms of the physical climate. And could you please take a read?
Yes, thank you. Thanks, Luis. So the first question we had coming in is from Matthew Switalski. And he says, do you know of any research concerning mosquito-based viral transmission increases and the observed uptick in rainfall in certain areas? It seems reasonable that an increase in mosquito breeding could also have something to do with an increase in ephemeral ponds, which serve as breeding grounds.
Yeah, there are many studies that take a look at rainfall and breeding sites for mosquitoes. Also, other interventions that raise water tables, like building dams. There are studies that show increase in the surface water and water table. So there are other studies that show the opposite. There's some cases where you can actually wash out mosquito larvae in some places. And so it's not straightforward, and it depends on the mosquito species and the disease that you're looking at, but certainly heavy rainfall, depending on where you are and which mosquito-borne diseases are endemic in that region, can absolutely affect vector-borne diseases.
Great, thank you. The next question in the chat is from Mercedes Pascual. And Mercedes, I know you're here. If you'd like to ask it live yourself, please feel free.
Uh-oh, this is going to be a tough question, I know.
No, it's not a tough question. It's that I find fascinating that, of course, you talk about El Nino, and there are many examples of relationships between ENSO and vector-borne or waterborne diseases, so seasonal epidemics. So I wonder whether you could comment a bit more about the connection between climate change and bigger El Ninos, I mean, where we are now, because this is happening also in the context of variability decadal variability, another variability in how the oceans are connecting to each other. So that besides what we are known, we are in for surprises. And I think that's the worst part of it. So these connections between change and variability and the implications for some of the phenomena you're talking about.
Right. Well, for those of you that don't know Mercedes Pascal, she's about the smartest climate disease modeler that I've ever met.
Please,
So,
Jonathan, skip that part of the answer.
Yeah. But it is true. And so, and she's done groundbreaking work on diseases related to El Nino, from malaria and cholera. And so the point is really, it's a great question. It's a great point that there's so much that we don't know about, the climate variability and the intensification of El Nino and the changes in frequency and the different patterns that emerge. I don't pretend to know the answer other than to say something that, of course, you're well familiar with. We've learned so much from El Nino because it's hard to know when you have unprecedented climate extremes, both in temperature and rainfall. It's hard to predict the future. We usually predict the future from the past, but if we've never had these experiences, we've learned so much, and a lot from your work, Mercedes, on how such extreme events driven by El Nino that do occur already, it gives us an analog or a window into the future. So, El Nino, seeing what happens with that extreme climate variability during El Nino has been just very important and foundational in our understanding the impacts, especially for infectious diseases, but also for malnutrition and droughts and things like that. So, these are big, how the changes in frequency of extreme events and maybe on top of each other or in different combinations. Imagine intensification of rainfall and the runoff, as you've shown in Bangladesh, runoff and contamination combined with sea surface temperatures. There's a lot that can surprise us that we don't have a handle on. And I think this is what is most concerning in the health field, is that the types of extremes in both in intensity and frequency and where they show up, there are going to be a lot of surprises. And I'm glad that Mercedes, you are just down the street.
Thanks, Jonathan and Mercedes, for that one. And then the last question we have currently in the chat. Before we go to Luis, though, I want to first encourage everyone on the call, please, if you'd like to ask a question, you can raise your hand, or even better, put it in the chat so that we know that you're there and we can get to your question. But Luis, you had the next question on the
Right. So I wanted to ask you, Jonathan, pick your brain to summarize what you think are sort of your top research gaps that we have, particularly as we look at health sciences and biological sciences that are driven by climate change. I think we just discussed the example of climate variability and epidemics, particularly vector-borne diseases. But what do you think are sort of gaps that we just don't know that we need research in?
Right. Well, there are lots of gaps, and I'll just say that one comment that I had from someone that does sustainable business is that this is a health emergency, and from direct heat waves to infectious diseases to malnutrition and drought, forced migration, that climate change affects all sectors in a big way. And that in understanding how much more risk there is from climate change, this individual told me, if you tell me that they're going to be 2 million more deaths every year from climate change, because climate affects all sectors, I won't be impressed. The risk is so huge across the board and across every sector that understanding more risk is not necessarily a place to focus on. I think we do need to focus on it so we can be prepared and adapt better. So for preparedness, that would be important. And it's one reason why my laboratory has shifted a little bit more, or actually a lot more, to looking at the health benefits and quantifying the health benefits to say, look, climate change, it's real, it's us, we're causing it. The consequences are serious. Scientists agree, but there's solutions, there's hope. And so we're focused mostly on trying to fill the big gap of the health benefits from across all sectors, and to make those clear to policymakers that not only are you doing this policy for climate reasons, but that policy doubles as a public health prevention. So my own bias is we need a lot more focus on the health benefits from climate action. But we do need, certainly any infectious disease is complicated. And so there's so much that we don't know about climate and various infectious diseases because each one is complicated. So there's a lot there. You know, the water issue in the United States is a big one. Our water treatment, and you know, that's something more locally, I think, that we were surprised about when we first did the first national assessment. So, and then how air pollution responds. You know, we know about pollution and trying to cut off emissions, but we understand ground level ozone is very temperature sensitive, but there's a big gap in some of the other air pollutants and how they will respond to stagnant air masses and warmer temperatures, aside from knowing how temperature sensitive ground level smog ozone is. So plenty of gaps, but I don't want to, I think we need to be acting. We need to be really getting, you know, there's no longer any reason to not jump into decarbonizing and then doing evaluations of really what's the payoff from the health perspective from decarbonizing society.
Thank you.
Great. The next question is Asana. See you not be able to ask your question. If you'd like to, please jump in. But I will, I think you're here.
Yeah, no, I'm here. So Jonathan, you showed at the beginning that is PM 2.5 from forest fire are 10 times more harmful. I think you showed within the context of maternal child health outcomes at the beginning, or you know. So what makes them more harmful? And I'm just trying to draw a parallel. Then does it mean then if it's the organic certain, what about the household fuel burning happens mostly in the low and middle income countries? I mean, I haven't seen reports that those PM 2.5 at a comparable dose is 10 times harmful in that context before. So I just wondered whether maybe it hasn't been documented well in that context, if that is true here in US.
Yeah, I don't think I can answer your question because I know that, you know, there's some issues with the organic carbon, but when you have a forest fire, you're also burning houses too. And so there are a lot of, you know, as far as what are in houses that go into flames as well, that is one issue. But if there's an air pollution expert on the call, I would defer the answer to that person because I really don't know in detail. I can't answer your extremely good question. So I'll have to dive into that study. Yeah.
Okay, thank you to you both. Next question is from Trevor. Trevor, would you like to ask it live?
Sure, yeah. I mean, I've just come back from a couple of months in India, and you know, this talk is quite US centric, I would say. And I cannot see any of this stuff happening in India, to be honest. The amount of coal consumption is the highest ever this last year, even despite the pandemic. And, you know, everyone's eating meat now. Sedentary lifestyles are becoming commoner. So everything's going in the opposite direction to what it should go in. And I honestly don't know how to reverse it.
Trevor, that's a great point. And I think that, you know, there are a couple of things. Number one, I do know there are studies that are looking at alternatives from coal-fired power plants in India and documenting and quantifying the health benefits. So there are activities as far as trying to build the evidence in India. But you're right that, you know, we need to, you know, take a look around the world where you've got the biggest challenges. But I point to the leapfrog effect that happened in Africa with cell phones. You know, many countries do not need to follow our dirty past as they develop. And when you look at the striking change in the cost of renewables, we're in a new world where, you know, we didn't have that before. There weren't those options. It's like we have to burn coal because it's cheap and it's you know, we're set up for that. We have an opportunity to leapfrog. I think it's the responsibility of the Global Environment Fund, the World Bank, and rich countries to make it possible for places like India to have a cleaner energy pathway. It's completely irresponsible of the United States, which is the #1 historic country, the #1 most responsible country for climate change. You know, if you look at the 50-year aggregate of emissions, the United States is #1. Now, China is out polluting us now, but if you look at responsibility, you know, the US, Canada, Germany, you know, these countries are, you know, need to step up. And if the United States doesn't step up and take a leadership role, there's no incentive for anyone else to. So I personally put a lot of pressure on the US to really step up and be a leader so that internationally things may happen. And I do think there are, you know, these golden opportunities where we don't have to be committed. Countries don't need to be committed to coal. And I think investors or especially coal is dead in this country. You know, if you're investing in coal, you're stupid. You know, no investor in their right mind would be investing in coal. And I think, you know, divestment movement is something, you know, as far as affecting oil companies. So I think there's a groundswell around the world where the signals are there. They need to happen faster. And we need to look at places like India and go for the low-hanging fruit there to say, there's a place that could switch fuel sources and have huge benefits. And the wealthy countries need to step up and help this along. But great comment.
Thank you, Jonathan. So we're more or less on time. So I know there are more questions, but remember that this is a dog series, so we'll return to many of these issues. So we're really very thankful to Jonathan to give us a very broad overview of many of the consequences and connections of climate change and how it is such a systemic problem, but also its opportunities. So and just share the next few talks. The next one I think will be on March 11th. So please attend and keep also suggesting other areas for our discussion and themes to be presented. So thank you so much, Jonathan. It's been very inspiring. We're immensely grateful, and we hope to see you soon with that promised dinner. Thank you very much.
Thank you so much. It's a pleasure and an honor. Really appreciate it.
Thank you.
Thank you, Jonathan.
Thanks. Good to see you, Mercedes.
Yes, yes. Let's see if we can. We are not as far, and we should try at least, and that would be nice. The question on the Zika emergence is very, very interesting because of this. How do you attribute, right, this emergence risk when you have this, one-time event? But that, anyhow, that's something interesting to discuss some other time. Thank
Well,
you very much.
I'm
Bye-bye.
expecting you to solve that Zika question, okay?
No, I'm more interested at the moment in the fact that it happened after, that El Nino happened after that decadal slowdown. So we were in a completely different mode of, and suddenly we had this enormous surprise. So it's very interesting, these problems between the decadal and the faster time scales. Anyhow, we can discuss it at
Let's
some
follow
point.
up. Well,
Yes,
I'll see you all at dinner in Chicago sometime.
Okay, bye-bye.
All right, see you.
Bye.